Tens of millions of Americans and Canadians are diagnosed every day with mental health problems ranging from anxiety to depression and substance abuse. A new study conducted by researchers at San Diego State University and Florida State University suggested that there has been a 7% increase in the number of people reporting severe mental health illnesses since April 2020. This increase in mental health issues is particularly acute in Afro Caribbean diaspora communities such as Toronto, Canada, which have been disproportionately affected by the coronavirus in ways that their white counterparts were not. This week I sat down with Leo Edwards, a Grenadian-Canadian clinical social worker who speaks of the mental health impact in the Afro Caribbean diaspora.
Some are referring to it as a plague, and many folks here in the city of Toronto are accessing psychotherapy and clinical supports to deal with mainly anxiety that's showing up for them, and for some issues around depression. The folks I've been seeing though in my practice, so like I said, it really expanded by leaps and bounds, are mainly racialized folks from the African diaspora. And I think that's interesting as well, that the folks that are coming forth are people that look like me and you. It means we too are experiencing, and perhaps much more than the dominant folks in the society, the impacts of this pandemic.
What are some of the anxieties that they have?
Yeah, it varies for folks, but I think what I'm hearing across the very many is issues around the uncertainty about the future. So the what ifs, lots of what if this gonna happen? Am I gonna be out of a job given the economic experiences that is current? I feel a lot of folks are quite concerned about what their future holds. And I think for many, they're grieving the familiar. They're not able to go to school. They're not able to work as they normally would. And that disruption, I think, is creating for many a bit of distress. We have to remember that anxiety in itself, there is nothing inherently wrong with anxiety. It's our body's natural response to perceive danger or the things that are perceived as a challenge. But it becomes a problem when we're unable to manage, contain, and move on from the anxiety that we are experiencing.
This increase in mental health issues is particularly acute in Afro Caribbean diaspora communities such as Toronto, Canada.
In fact, I read a paper that talked about the impacts of being quarantined and the impact of disruption on people's psychological health. And given that folks' routine has been disrupted, and more importantly, people are uncertain about their economic future, that in itself is going to cause tremendous mental distress for folks. So I think we would expect the next wave of this pandemic for now is the tangibles. It's not being able to go to work and school and not having a steady flow of income. The next wave of this pandemic, unfortunately, will be mental health concerns. I feel we'll see an increase in folks that are living with all kinds of generalized anxiety. I think we'll see a number of folks who are experiencing post-traumatic stress from the experience. And you have to also think about the vulnerable folks, so perhaps the very young and women who are probably in environments and spaces where they're experiencing kinds of abuse, also will come up with a bit of trauma from this experience after being sort of, for want of a better word, held captive. So I think clinicians like myself have to be very aware of those things, because I think that's definitely where we're moving into an era where we'll have to support people that are presenting with all kinds of mental distress.
The clinician also offers advice for Caribbean parents who may have to work with children at home with learning disabilities during this period of mandated isolation. One such learning disability, which has gotten the attention of educators in the Caribbean recently, is autism. The Caribbean Examinations Council, the organization responsible for the primary, secondary, and tertiary academic assessment of learners in the English speaking Caribbean, suggested that autism is a learning issue that has to be addressed urgently. The Council says the suggestion is for them to begin to investigate how their assessment products can give consideration to people who are autistic in writing their examinations.
The adult child or the young person is suspected of autism but doesn't really have the diagnosis. And we have to be really clear that autism is on a spectrum, so it's very possible that you can have autism and be very verbal, but that you lack in the other areas, such as you have probably a ritualistic or repetitive behavior or poor social skills. Mm-hmm. It's possible as well that you may be nonverbal where you don't have any language. So I think given the complexity of autism, how it may show up, there is no one person or two person with the same kind of autism. It varies as our DNA varies. Mm-hmm. And I think that makes it really difficult to support the person on the spectrum and the caregiver, because there's no cookie cutter method that would fit everyone. But what has been evident is that there are really some strategies that can be applied across the board that may be beneficial. And for the caregivers in Grenada, who may find themselves now most responsible for managing their child or their loved one with autism at home during moments where they may be at school, I think there are some practical things that they can consider. And the first is that as the caregiver, as the parent, it will be really important that they manage their own anxiety, that they appear to be in a really calm state. Because you have to remember, people on the spectrum, they're very visual. And so if you're able to keep a calm demeanor, that will really work well for the person on the spectrum. It will lower their own anxiety and their own confusion about what this COVID situation that we're experiencing.
Reporting from Washington, D.C., this is Kellen Butt.